many out there probably don't feel that way. So what are the most important points that physicians need to understand about these changes?
Great question. I think physicians need to understand that this is a large panoply of options to select among, that we have the opportunity to decide what category of physician we choose to be in this new program, and we have an opportunity to select among a host of quality measures, for example, and to make many other choices along the way. It's important, as we're first approaching this, to sequence those choices so that those of us who have a certain category of choice to make are aware of what they are and what the implications of them would be. Whereas other people don't spend extra time focusing on something that really isn't a choice for them because of the size of the organization they are, or the number of patients that they treat, or the volume of their reimbursement from certain organizations, for example. So understanding what is the right sequence to make a choice, I think, is the first step for most physicians in actually implementing this.
You know how we all love change, right? And we're resistant to change. And in this situation, I guess you can literally say it took an act of Congress to change the way that we're approaching healthcare. One approach to change is to do nothing and hope that it'll go away. And MACRA, however, to those who might feel that way, MACRA passed with an overwhelming bipartisan majority. And so I don't think that it's going to change. It's not going to go away. Regardless of the outcome of elections, regardless of the outcome of other terms of Congress, the likelihood that this changes and goes away in totality is nominal. So rather than just say, yeah, I get it, it's not really coming, I hear about it, and I don't need to change, it's time to, that will be one of our messages to the providers that we work with. It's real. Ultimately, though, the other message, too, would be that this is all about enhancing the value of care for our patients, which is a good thing. It's a good thing. Granted, it requires change, but the purpose of it and the intent of it, and really the way that it's designed, is to produce good results. So rather, you can either resist it and ultimately try to play catch up and maybe face some penalties in the short term, or you can go, I get it, I understand that it represents some change, and embrace some of those changes. I remember when I was in practice every day, this represents a sea change from what I did. Traditionally, I don't know if you guys are any different, but I would show up for practice in the morning, see what was on my schedule, see what patients were scheduled, and my focus was really on the next patient in the next room, and that patient who I was seeing then, and who's the next patient in the next room. Over time, I got kind of tired of the thought and the process of doing hospital follow-ups and consultations and not having all the material that I needed in order to properly evaluate that patient. So I started a process of, a few days before, looking at the schedule that was ahead and saying, okay, I have a hospital follow-up coming up. Do we have everything that we need? I have a consultation coming up. Do we have the material that we need in order to appropriately manage this patient? And so I started asking those questions 2 to 3 days proactively. Then it turned into 2 to 3 weeks proactively. Those were good things. It was good for me, because I had the information that I needed to appropriately care for the patient, and it was good for the patient, and it was efficient for the system. What we're talking about is taking that to the next level and working as a team to proactively address needs that patients may not necessarily even be aware of and may not themselves be yet prioritizing in their own health. So ultimately, the goal here is a proactive, multidisciplinary, team-based approach, which I think is good.